Good evening and welcome to the National Council of Negro Women Influenza Town Hall. I'm Rosalind Hannibal Booker, Director of Philanthropy. Tonight, we will have an informative dialogue about the flu with one of the country's leading family physicians. Now, it is my pleasure to introduce NCNW's 8th National President and Chair, Dr. Thelma T. Daly.
Well, good evening, and thank you, Ms. Booker, and thank you, Dr. Savoy and Dr. Elgin, for being on tonight, and for all of those who are out there gathered to be a part of this very, very interesting and needed discussion that will emerge tonight. I kind of want to go back and take some of you to the year of 1952, because it was that year that Jonas Salk developed the polio vaccination. And look, today, we don't have children walking around suffering or dying with polio. It was just a needle to go in, and the fear has eradicated. And we look at it, and it's all in the past. I cite that to say, yeah, we're going to talk about influenza. And some people have some radical ideas about it, and some people refusing to even to get a vaccination. But if you go back and look what happened to polio and how all of the lives of the children have been saved, if we could get across just that part, we would say to our adults that yes, if we all want to stay healthy and if we want others to stay healthy, listen to this panel tonight. Listen to Dr. Savoy. Listen to Dr. Elgin tonight and ask questions so that we can all leave informed, and not only informed, so that we will take the needed action that we needed to take. And I'm pointing to my left arm because it was in September, early September, Dr. Elgin, that I got my flu shot. And I'm going to point to my right here, because 2 days after getting my flu shot, you know what I got in here? I got my booster. I got my third booster in here. So my flu shot here and my booster here. And there was no fear, no pain, no headaches, no anything. But I felt safer having done it, because I didn't think that I wanted to get influenza. I didn't think I wanted to affect somebody else. So it's for the safety of all of us. I salute all of you who are on tonight, those who are out there virtually looking at us, and to you, Ms. Booker, and to Dr. Savoy, and to Dr. Elgin for putting on this very, very powerful, much needed webinar tonight. It's all yours. Thank you so very much.
Thank you, Dr. Daly, and we salute you and we thank you for your leadership. Leading tonight's conversation is Dr. Angelina Elgin. She is an acute care nurse practitioner, a member of the nursing faculty at Chamberlain University in Houston, Texas, and NCNW's Health Equity Co-Chair. Dr. Elgin is the first African-American female fighter in the state of Missouri to be appointed to the position of fire chief. She is a registered professional nurse with over 23 years of experience in intensive care, emergency medicine, and flight nursing. We will first have a tech briefing by our very own Whitney Guilford, and then we will turn it over to Dr. Elgin. Ms. Whitney?
Welcome, everyone. Greetings from the NCNW Comms team. I am the Communications Media Manager. I will be handling your technical needs tonight. The first thing I would like you to know is that we do not use the chat function. We use the Q&A. And also, please save all questions and answers until the end of the session. And we will have a specific time for Q&A and polls. Lastly, many of you ask where you can find this after the webinar is over. This will be posted on YouTube. And I'm going to toss it back to Ms. Hannibal Booker. Oh, I'm sorry, Dr.
Thank you. Yes, we were tossing it back to Ms. Elgin so we can get into this important conversation. Dr. Elgin?
Good evening, everyone. I caught the ball. Thank you so much for having me, and thank you, Dr. Savoy, for joining us. And I look forward to having this very important conversation about flu. So before we get started, let's kind of see what who's in our audience and kind of help us gauge where the conversation needs to go. So our first poll, I would like to ask the question, how many of our participants have actually received the flu vaccine this year? Yes, 70% and 30% no. Okay, so I have another question. If you have received the flu vaccine this year, where did you receive your flu vaccine? So it's your primary care physician, retail pharmacy, urgent care, or your health clinic. So we have 45% received it at a retail pharmacy, urgent care none, health clinic 18%, and then our primary physicians 36%. Great, thank you for participating in that. So I'm just going to jump right in, and Dr. Savoy, let's have a conversation about how is this flu season different from the flu seasons in the past with COVID and other respiratory viruses now in the mix?
So thank you so much. I think that's a wonderful question and a great way to start off the discussion because this flu season actually does feel different. So we kind of got a break for the last 2 years. It seemed like flu kind of went all the way away, and it's true, it actually really did go all the way away. During COVID, we were doing so much other protective activity. So for example, putting on masks, being distanced from one another, doing really good hand washing. We barely saw influenza at all. So there was hardly any cases during 2020 and 2021. What we noticed though is that as people started to get back out in society and interacting with one another, not wearing their masks as often, honestly, not necessarily washing their hands as often as they were before, like that hand sanitizer is on the wall, but not everybody's stopping the way they were at the beginning of COVID. We're starting to see the rates start to go back up. And this year, we actually are already seeing record high numbers of influenza in certain parts of the country at a time of the year when normally we wouldn't. So I'm currently in the DC area. We're already having high rates of influenza-like illness and a rate that we normally don't see until more like February or January. And so it's actually amazing to see how we're already starting to have symptoms for people, even in the time of the year when you wouldn't expect it. This year it gets complicated because you could get COVID. So even though we stopped talking about it, many people think it went away. COVID has not gone away. It is still quite possible to get COVID. The beautiful part is for people who got a vaccine and have gotten their booster, the chances of them actually getting sick enough with COVID that they have to get admitted to the hospital or dying from COVID goes down a lot. And so we're seeing less people end up in the hospital than had been before, partly because people have been vaccinated and been doing a really great job getting their booster doses. But there definitely are still cases of COVID floating around. And for those folks who are still unprotected from the vaccine, there's still folks getting sick and dying. And so it's important to know that that's still around. And then on top of that, if you've probably been watching the news at all, you've been hearing about this thing they're calling the triple-demic, where they've talked about there's sort of 3 infections going around that are really hitting our pediatrics, our kids, and our older population. So practically they talk about being over 65, but really in this case, it's probably over 75 with RSV, or respiratory syncytial virus. And so that's another upper respiratory infection that can make you pretty sick. It causes a really thick mucus, and for kids in particular, they can't cough it up, so they end up having trouble and ending up admitted to the hospital. And so what's about to happen this flu season, this winter, is that you've got the return of all the normal colds that people get. You've got the ongoing problem with COVID. You've got the return of influenza with a vengeance. And then you've got RSV, which didn't used to start this early in the season either, and it's already around and sort of getting people sick. And so it's going to be a rough winter, I think. And honestly, I just think we need to all be thinking about it and doing whatever we can do to prevent getting sick from the parts that we can. We can't do really a whole bunch about the RSV one. We don't have a vaccine for that. but we do for COVID and for influenza. And so this is an opportunity for us to sort of prevent ourselves from getting sick before it's even a problem.
I think one thing that we also have to let our listeners know is the importance still of using hand sanitizer, of masking. And we want so much to be able to be free from all of the COVID stuff. But I believe that as a part of talking about the flu, we should also talk about some prevention. So other than getting our flu vaccine, and other than taking still precautions with making sure we wash our hands and making sure we're masking, those are some things that I would recommend. But are there any other ideas that you should think that we should let our audience know?
So one other one that I think is really important that we had gotten a little bit better at during COVID, but we're starting to sort of slip back, is not going out or going to work when we're sick. So when people were having cold symptoms during the height of COVID, people were really good about staying home and not going around other folks because they're thinking that they didn't want to infect them or make them sick or have them cause a problem. And lately, I have noticed a fair number of people who come in and their exposure wasn't because they were being careless or not doing what they were supposed to do. It's because someone else decided to come into their space and they had been sick and did know that they weren't feeling well. And oftentimes people are like, oh, I just thought I had allergies or I just thought I had a sniffle. We don't really need to be trying to guess. I mean, like, honestly, at this point, it's just not a safe time to be guessing whether it's allergies or not allergies. And I just think that people need to be really mindful about, if your kids are sick, keeping them out of daycare, keeping them out of school. And if you're sick, not going to work and infecting other people. And I do think there's a benefit to, wiping off your surfaces and washing your hands and really thinking about spacing out. So I know that people got a lot of really, really confusing messages about what to do with masks. And I apologize for that because I think that the medical community could have done a better job helping explain to people why you were wearing a mask in the first place, because then you can make a better judgment about when you need one and when you don't. And so I think we're leaving people a little bit confused, but I will tell you what I use as a rule of thumb, and then you guys can kind of do with it what you want. So practically, you're putting on a mask for two reasons. Reason number one is that if it turns out that you're sick and you didn't know, the droplets that you sneezed out or cough out, or even just spit out when you're talking and you're not even realizing that you're spitting out little small droplets, those respiratory droplets can't hit somebody else. So if it turns out you're sick and you didn't know yet, you won't be making anybody else sick. And then the reverse is true, that if you happen to be out in a space and it turns out somebody around you is sick, you're not going to be as likely to get sick because the droplets don't get to you. Now, the challenge is that, if you're sick, does that mean you should just put on the mask and go anywhere? Well, I mean, I honestly don't recommend that if you're going to be in a really tight, closed up space and you're feeling sick, wearing a mask isn't the best answer. But if you told me you had to put on your mask to run into the store to get your medication, put on the mask and go get your medication. Like, we're not trying to have you get sick or have a problem, even worse than you would have because you couldn't do what you needed to do. But it's probably not the day to go to the basketball game. I mean, like, you just don't need to be inside and around crowds of people. On the flip side, like, if you were outside, so if you're going to be sitting outside at the park and there's not really a lot of people very close upon you, you could take your mask off and breathe, and chances that you're going to get COVID or even influenza are fairly low. And so I think people can make some choices about what they're going to do, and it doesn't have to be 100% on or 100% off, that you can use your own guidance and your own common sense to think about what your risk is, what your concerns are, and whether or not that's something that makes sense for you. Because if you've got other medical conditions, you may have a much lower threshold for wanting to be protected than maybe somebody who has less. But for me, I always think about, I don't want to make my mom sick. I don't want to make my dad sick. I certainly don't want to make the children sick around me. And so, I use my mask, especially when I have to be inside or in closed spaces.
Well, I want to back up just a little bit. I want to go all the way back, actually. And I want you to introduce yourself. Tell us who you are, where do you work, because you are giving us a lot of great information, and we want people to know how important this information is. But because of the type of work you do, we want to kind of connect that. So tell us a little bit about yourself.
Sure. So I'm a family physician by training. I actually got my medical degree at the University of Maryland in Baltimore. And then I did residency in Pennsylvania at a place called Crozier Keystone. And then I went on to do residency training, which means I teach other doctors how to become doctors. So I teach medical students and resident doctors for a very long time. My last job before the job I have now, I was department chair for family medicine at Temple University in Philadelphia. And I recently left Temple to go to the American Academy of Family Physicians to take a job that allows me to work on education. So I'm a senior vice president overseeing education. So all of the education from medical students all the way through to practicing doctors. I do diversity and inclusion, so I'm in charge of our inclusiveness programming. And then I also cover our physician health and well-being work. And so I still teach at Temple, so I still have a faculty job there where I get to take care of medical students and dental students and help them learn information, which is really kind of nice. And so get the opportunity to talk about patient care, get the opportunity to teach other people how to do that. And I have a passion for immunizations and vaccines. It's something that I've been interested in since early in my career because I think prevention is very important. One of the things that drove me into wanting to go into family medicine, drove me into getting my public health degree, so I have a master's degree in public health also, is that I saw too many people who look like me get sick from things that other people didn't get sick from. And when I learned more about it, it turned out that oftentimes we were denied the care, or then we chose not to get the care because we had a fear of where the care came from. And so we're getting sick and continuing to get sick from things that we could now be prevented from getting because historical legacies have caused us to have concern. And I don't think the legacies are wrong. I don't think people have any reason to not have a concern if you have a concern, but I do think we should give people a space to talk about it, help them to get over the concerns that they have, and to be able to make educated choices about whether they want to take on, preventive services. There's lots of different things. So from colonoscopies to vaccines to sort of everything that we could be doing to protect our health. Today, I'm excited because we're talking about flu vaccine, which to me is really important because every single year I have patients end up in the hospital with influenza and some of them don't make it. And it hurts me every time because it's something that I could have prevented. And if I could have just talked them into being able to get that vaccine, I don't think they would have gotten in the hospital and I don't think they would have died. And so it just is really important to me to be able to have the opportunity to share those thoughts and help people get their questions answered. From a person who would tell them the truth. Because I mean, if you ask me a question, I know the answer, I'm gonna tell you. And I also will tell you if I think that's not what you really need to do, based on what I know and the evidence that I'm aware of. And so I want people to feel like they have an opportunity to ask the questions that they need.
That's great. Thank you for that. So then our next question is, why do you believe that some people and communities, our communities, are skeptical of the flu vaccine? And what are some of the common side effects?
So I think that a lot of times folks are worried that there's a history of stories that are told about research and how people have done research on Black and brown bodies throughout the history of medicine. And vaccines feel somewhat new age to people. So you're injecting them with something, they don't know exactly what's in the injection, they're not entirely sure what's going to happen. And oftentimes people don't tell the whole truth about the potential side effects that a person might feel or what's going to happen. And I think that sets you up to have distrust so that you just are not confident that the thing that you're getting is going to be helpful. You don't always understand how it works. You don't know how to know whether what you got was the right thing or not the right thing. And I think that combination just makes it very scary. So if you're sort of taking historical racism and then you lay on top of that current day racism, and then you lay on top of that just fear about science in general and how fast sometimes it seems like science moves, people just have a lot of questions. And oftentimes I think when you ask questions of the medical community, sometimes we get a little bit judgy because we're sort of annoyed. You feel like I went to all this medical school and you're asking me 101 questions. Why don't you just trust me? And what I find is that most of the time the patients aren't judging the doctor at all. They just have questions because they want to know more. And when you can get an opportunity to actually have a dialogue and a discussion, most of the time people just wanted to know more for their own health and for the good of themselves. And so that really helps a lot. When I talk about the not telling the truth part, it's because people say stuff to me all the time and I just shake my head. So I totally agree that getting the flu shot sometimes makes you not feel good. So I would never lie to you and be like, getting the flu shot makes you feel like the best you've ever had. I get a flu shot every year. I have gotten a flu shot every year since I was in medical school. The year I got it the first time was because it turned out I got the flu and I have never felt that bad in my life until I got COVID. It was just an absolute horrible feeling. My hair hurt. I didn't know hair could hurt. My hair hurt, everything hurt. It was awful. And I haven't really gotten the flu since. And so when I think about, I didn't get sick, I didn't die, but I was out of commission for a week. I did not feel well. That is not how sick you're going to feel by getting the flu shot. So when people say the flu shot gave me the flu, my answer is, okay, that's not true. The flu shot does not and will not give you the flu. The only chance you even remotely have that the flu shot is going to give you the flu is if you get the one that's the nose spray. And that's because that one has a mild form of live flu vaccine, live flu. So it actually has some of the live virus in it, and that's how it's getting you your immunity. But every vaccine that you're getting that's a shot for influenza, there's no live virus in it, so it can't actually give you the flu. What it can do, though, is trigger your immune system, which is actually what it's supposed to do. So your immune system is telling you that it's working when it does the things that tries to fight whatever it is that things that you caught. So that means I could have a fever. That means I could start to have achiness. That means I might get chills. It means I might get a headache. I might not feel so good and want to go lay down because I feel really tired. These are all the signs that your immune system is actually taking its attention off of just hanging out and actually turning its attention to whatever this thing was that you just got injected with. And the reason that that's a beautiful thing, and you should actually be happy when that happens, is because that's your body making the antibodies that you need so that the next time your body sees influenza, so somebody coughs on you or you walk by and touch the wrong thing, you actually are going to have that immune response super fast before you even have a chance to get sick. And that's how it actually protects you against getting the flu on the other side. So I think it's not fair when people are like, no, you don't get sick when you get a flu shot. Yeah, you don't get sick, meaning you don't catch influenza from the flu vaccine. But I have never gotten a flu shot and not felt great. Like, I mean, I've always taken it on the end of the week, Thursday or Friday, so that way I can rest over the weekend and feel better when it's time to go back. And so I just think people should tell the truth. I mean, so practically, no, you're not going to feel great. I'm so glad Dr. Daly didn't have a sore arm. I did. So my arm hurt for a couple of days after I got my shot. I could tell you exactly where they stuck me with that needle. So on the day of the shot, it felt fine, but the next day I felt sore, and I could tell you exactly where it was. Would it mean I shouldn't get a shot? No, but I think you should tell people the truth, because if you had something really important to do the very next day, you may not want to put it in the arm where they had to, pitch the ball or something like that. So you can make it a little easier for people. So those are the side effects that you tend to get, and they're not always in everybody. So if you got the flu vaccine and you really didn't have any symptoms, it doesn't mean your immune system didn't necessarily work or that you're not going to be protected. It's just that some people's immune systems are a bit dramatic, like mine, and want to just make sure that I know that I got the vaccine. And so it just tends to be a little bit more uncomfortable. But it doesn't stop you necessarily from getting the vaccine or telling you that you shouldn't get the vaccine or there's something wrong with it.
Well, thank you for that. I think the medical community can do a better job at empowering our people to ask questions. And I always tell my patients, if I'm not in the room, write it on the whiteboard or write it on a sheet of paper and have the nurse come get me and let me know if you have any other questions. And then also spending the time to say, okay, what question do you have? And then actually staying there and not saying anything and giving them the opportunity to think of questions. So for our listeners, I empower you to have those questions on a sheet of paper, write it down on a pad of paper. And you are supposed to ask questions. You are supposed to engage your primary care physician or engage your provider, because the only way that you're going to know about why it's important to get a vaccine, whether it's the flu vaccine, COVID vaccine, the only way you're going to know is to ask questions. And if you feel that you are being intimidated, then you need to say, I have a right to ask these questions. I have a right to know about what's going on. So we encourage you to do that. Our next question is, how does receiving...
Go on from that. So
Yes.
before you leave that one, so one of the things I will tell you, and I'll just tell the audience just in general. So, as a person who's seen patients for a long time now, I genuinely do enjoy when people ask me questions, because that's how I know you're paying attention. So like, if you're listening long enough, you're going to have a question at some point. And so that's actually a good sign. One of the things that I think sometimes we don't do well as when we're in the patient role, as opposed to being on the clinician side, is that sometimes we assume that the doctor or the nurse practitioner or the PA is going to yell at you when you ask the question. So you have all your defenses up before you've even asked the question. And so, I mean, to put it in Margot speak, you come at me crazy with some questions. I mean, you're already mad at me and I haven't even heard your question yet, or you're assuming that I'm going to say something negative to you. So you're throwing things that are already mad. And I think sometimes we could make it easier if we just honestly ask the question what we really meant. I'm not sure I have questions is a perfectly reasonable way to start. And if you get to a place where the person who you're working with is really about their job, like they really know what they're doing, they don't get intimidated by the fact that you're asking them a question. What they get is curious around what it is you want to know more about. And then they give you the information that you need to go make your decision. So it shouldn't be a fight. Like, this doesn't have to be a battle. It can be a conversation. And I find that sometimes people just start off so mad, I think because they just had bad experiences with other people or something different. They don't give the new person the benefit of the doubt. And then it makes the other person defensive. And now you're having this weird sort of angry tension conversation. And vaccines are ones where, I'll be honest, doctors have been fighting with people about vaccines for years. Every single year you have to fight about this flu vaccine. And every single year, I know you're the first one you think to tell me that the flu vaccine really does cause you the flu. I don't know how many times a day during this time of the year somebody tells me that. So I don't know that the doctors are always mad. I think sometimes they're tired. And so if we could just start from a positive spot, and then if the doctor goes crazy, you go crazy. But if they didn't, you might actually get them to answer your question, because they might not feel like you're sort of being mean about it. You're asking a question, which is perfectly fine. And so I think, I give this advice to doctors too. Like I said, I still teach, and I tell them all the time, like, just because a patient's asking a question doesn't mean they're hostile or mad either. So like, we don't have to be mad. We're actually both on the same team. So like, really, we're both here to make sure that you end up healthy. My job is just to give you the right information so that you can then do what you need to do to choose the healthcare that you need to get you to the life that you want to have. But sometimes I just noticed that sometimes I've found that sometimes patients talk to me crazy, and then I have to check myself before I can answer the question. And I realize nobody probably ever tells you that. And so it's probably my job to say it just at least once, so you heard it just once. So like, sometimes it's us being kind of mad going in, and then we sort of set off this whole conversation different than we mean to. And so I just say that to you because vaccines are a touchy one for people. Like, it's turned into this political conversation. When I tell you to get a flu shot, it ain't got nothing to do with who you voted for. It just has to do with the fact that I don't want you to die. I mean, I like you. I have a thing that might stop you from dying. I'd like to offer it to you. It's really that simple. And sometimes I tell you, people get you in that exam room and they want to tell you about stuff you didn't ask. And they're mad at you because they think you're pushing a political agenda. And really, I just didn't want you to die. It's really that simple. And so don't assume that everybody's going to be mad. And if you do find a doctor or a clinician in general who's really angry about it, or like just snippy or short with you, you probably have the wrong clinician and you need to go find somebody else.
Very true. Thank you for that. So to our third question, how does receiving the flu vaccine mitigate the effects of the flu? And I think you alluded to that.
Yeah, so the way that the flu vaccine works is that it basically gives your body a sneak peek of what influenza looks like that particular season. So the shot changes every year because the types of influenza that are floating around change every year. And so we kind of sort of guess what it's going to be, but it's an educated guess because the people in the southern hemisphere of the world, so think like the folks in Australia, get their flu season about 6 months before we do. And so we look to see what's going on in Australia, and then we modify the flu vaccine every year to look closer to what it looks like that they saw the year that we're about to get our flu vaccine. So most of the time, they kind of catch the things that are going to be going around. That way, your body basically gets a sneak preview. It gets to pre-make antibodies against that influenza virus. And then if your body sees influenza again, so even if it's not the exact same one that was in the vaccine, but it even looks similar, your body can make antibodies to try to prevent you from getting sick. Now, the challenge is that no vaccine is perfect. So there's no vaccine that I can give you that will make it 100% sure that you're never going to get that infection. So like, there are people every year who get their flu vaccine and still end up getting influenza. The difference is, and the reason why we still think it's important, is because if you give your body that head start, that ability to make the antibodies, you don't get as sick as you would have if your body had to start from zero. And what that means is that you don't end up in the hospital and you don't end up dead. And for us, that's important enough to do it, even if you might still get influenza, might still have symptoms, might still have trouble. And luckily for us, we do have medications that can treat influenza. So if you did end up getting sick, we've got treatments that will work that can help make it better also. But you still have a much easier time if you actually get the vaccine, even if you were going to end up getting sick during the season anyway. So it's kind of like a preview for your body, so your body can kind of get ready. And then when flu shows up, it's just ready to fight that battle.
Well, and the other thing that I want to add to that is, if you start developing symptoms of the flu, you really need to get to your primary care physician right away, because there is a very short time frame in which that medication can actually work and that it needs to be administered. So I really want to get into the favorite time of the year, my favorite time of the year, Thanksgiving and Christmas. And all of the families are getting together. We talked about flu. We talked about the triple threat, right? Flu, RSV, COVID. And honestly, that covers the whole gamut of the entire lifespan. So we have the kiddos that's coming over. We have grandma, grandpa, uncle, that's coming over. I know we kind of talked about last year, we suggested like having a type of COVID plan. But do you think we should start thinking about having a plan, period, for the triple threat that we kind of talked about before?
I mean, I do think it makes sense. So, I mean, I hate to be the downer person and say, like, you don't want grandma to come to dinner, but I don't know any grandma that's willing to die for the turkey that you're going to make. And so if they got to choose between, having virtual dinner maybe this year because you're sick, or having dinner in person with you, but getting sick enough that they might end up in the hospital, I don't think that's what we would ever choose. The challenge that we're going to run into, and I don't have a great answer for it, but the challenge is that you don't always know you're going to be sick when you're sick. And so you might have made all these plans to get together, and then the day before it turns out you're not feeling well. And what I just caution people is that if you're genuinely not feeling well, if you're even not sure but you think you're not feeling well, I just need you to put the health of everybody else before your own. And so really just stay home. I know that, in our family, our COVID plan was always that, I was the one that was probably the most likely to get sick, maybe second to my sister because she was a school teacher, so she's around a bunch of kids. So if you really felt like you were sick, the plan was supposed to be you stay home. You have to let us know. People were going to drop off food on the doorstep so you could still eat. But then we were just going to Zoom call it. So we were just going to do it over Zoom. And so you still got to see the family. You still got to interact, but that you didn't have the contact or you were going to make anybody sick. I would just hate to see people end up in a situation where you made the people in your family ill and you didn't intend to. I just don't think that's, it's just not a great situation. When they talk about people having a bubble, like you remember during COVID, there was that whole thing about your people in your bubble. So It's a little bit harder to have a people in your bubble thing around influenza or RSV. They don't quite work the same way as COVID. And so it's harder to do that. You would just have to go by the symptoms that people are having at the time. The flag that I would put out for folks is that with COVID, you could say like, hey, I'm not sure if I'm feeling sick. I've got this test kit at home that I can actually test and see whether it's positive or negative, and at least have some clue going in whether or not maybe I thought I was sick. And particularly if I had a few days, I could take a test, repeat it in a couple of days, and then know for sure if it's negative that I probably don't have COVID and I could go and interact. The problem that you're going to have this year is that you don't have a test for RSV at home. You don't have a test for influenza at home. So that COVID test being negative, even if you had the two that were separated by time, shouldn't actually make you feel that much better if you're actually feeling sick. So if you're having symptoms, even if it's not COVID, that COVID test is negative, you could still have influenza or you could have RSV. And so I really do need you to give your primary care clinician a call, mostly because you mentioned this earlier, like for influenza and COVID, the medicines are not the same. And for influenza, you really need to get started within the first 72 hours from when your symptoms started. And so if you decide you're going to go wait it out and sleep on it, think about it, and you don't call me back till 4 days later, it's really hard for me to get you treated. So, I mean, if you had other immune system problems, I might think about it, knowing that it's not going to work that great, but it's still better than you ending up in the hospital. But for the average person, it's not going to be helpful and people aren't going to prescribe it. So you kind of get stuck being sick much longer than you needed to. And the treatment for COVID is not the same as the treatment is for influenza. So you actually do need to talk to somebody because they're prescriptions and you need the right prescription called in for what's going on with you. I will tell you that a lot of primary care offices are not necessarily going to make you have to wait 4 days to come in for an appointment to do something different. For many of us, we've already figured out that you're going to have to use telemedicine better or telephone medicine better to triage people. So you know, like who needs to come in versus who's doing okay, and figure out who needs a script called in, who needs to go get tested, and how you want to make that work. And so don't not call because you're trying not to bother people. Don't not call because you're just trying to figure it out on your own. Err on the side of calling this season, and then let them help you figure out where you need to get tested or what you need to do to make sure you're getting the right medication for the right problem and not just sort of waiting it out and realizing that you actually did have something that you could have prevented or gotten rid of.
And I think the one most important thing out of that is you have to be honest about your symptoms. If you truly feel like you're sick, then maybe you need to not participate this year or participate in a different way, whether it's like you said through Zoom or dropping off a plate at the door. But the most important thing is you want to make sure that everyone for the holidays are going to be safe.
Absolutely.
Well, those were my questions. Are there any other questions or any other bullet points that we want to cover? I'm going to turn it back over to
So I will tell you while we're thinking about the other groups of people, I don't remember us saying it out loud, so just in case we hadn't said it yet. So sometimes people wonder who can get a shot. So the recommendation is that everybody 6 months and older who doesn't have some allergy to the actual influenza vaccine is eligible to get a flu shot and should get one every year. There are different kinds of flu vaccine. So there are now what they call high dose flu vaccines that are intentionally made to have a little bit more of a robust response that we use in patients who are 65 and older or people who have a reduced immune system. The idea is that as you get older, sometimes your immune system doesn't make the same response. And so it actually gives you a little bit more of it so that you can actually have a better response and it reduces your risk of getting sick. And so there actually are some different kinds of flu vaccine. We do have that nasal spray flu vaccine. The challenge is that you really can only get it if you're a really healthy person. So you can't have like asthma or other sort of medical problems and get that one. Most of the time we find that we use it for children who don't have other medical issues, or for people who are really, really afraid of needles. So sometimes it works for those folks if they're able to get it. The challenge with that one, the nasal spray one, is, like I said, that's the only one that actually does have influenza in it. And so you have to be a little bit careful if, for example, you're going to be around somebody who's had chemotherapy or has an immune suppression problem. You don't want to be accidentally shedding the flu virus and going home to them. And so sometimes you have to ask a couple more questions about the people in the family before you give that nasal spray one. But by and large, people are going to get the shot, and it's a pretty standard shot. And so it's not a big deal. Dr. Daly mentioned this earlier, and she's absolutely right, that you can get your COVID shot and your flu shot together. You can actually get them on the same day if you wanted. You also could get your shingles vaccine or your Tdap vaccine. Any of the other vaccines you can get at the same time as your flu and your COVID shot. So don't feel like, oh, I have to make 2 appointments to come back and do whatever. That's not necessary. Like, you actually can have them on the same day. You didn't even have to necessarily come back later unless you just wanted to. So oftentimes we'll just get them done on the same day so that you don't have to worry about it. And if you haven't gotten your flu vaccine already, go and get it now. There's no shortage this year. There's not any like triage to only certain people can get it because we're running low. They're not running low. They've got plenty of vaccine. You should go ahead and get it. Ideally, you want to get it sooner rather than later. Normally, people tell you try to get it before Halloween because they want to give people enough time to make the immune response. So it usually takes you about 2 weeks after you get the vaccine to be fully protected. You know, Thanksgiving is right around the corner. So if you want to be protected before you roll up in there for Thanksgiving, you're going to have to get your shot like yesterday so that you can have your vaccine, your antibodies all ready to go. But we still got plenty of time. So don't not get vaccinated because you feel like you missed a window. You still got plenty of time. But I would recommend going ahead and getting vaccinated sooner rather than later. Because like I said, we're already seeing flu activity. And it's super early in the season. Like, this isn't when we would normally be seeing that activity. And so I think we might be in for a rough year. So you don't have to wait. Go ahead and get it done sooner rather than later. I think that's all the big stuff.
And the pneumonia vaccine as well.
Yes.
Yes.
Thank you,
Okay.
Dr. Elgin. And Dr. Savoy, wow, that is a lot of information. I've been sitting here taking notes. I do have one question, and you just hit on a point about when to take the influenza shot. I know earlier in the year, we heard messages about waiting, and now we're hearing messages about go get the shot. Can you talk a little about why we heard the earlier messages, and again, expand on when is that sweet spot, that window where individuals should be seeing a physician to get the flu shot?
So it's interesting because it shifted a little bit after COVID. So historically, what they would tell you is that you should probably get your flu vaccine somewhere between the beginning of September and the end of October to buy yourself, a couple weeks for your immunization to get in place, thinking that flu season normally starts to kick up in November and it peaks somewhere around February and then goes away in March. Like, in general, that's the way the flu season looks. This year, the flu season started early, but it also didn't quite end last year. Like, it sort of trailed on in a weird way. So there were people still cropping up with like flu, and even though it was the summertime, which didn't really make a lot of sense. And then this new season is starting even before it's supposed to have started. And there was a window where people were like, oh, we've got all this flu vaccine. We're not running short this year. Let's just go ahead and put it out in the market. So people were starting to get flu vaccines in like August, and not at the end of August, like at the beginning of August. And the question became, well, is that a problem? So what happens if I get my flu vaccine at the beginning of August, and now I get my my immunity in place in the middle of August, but then my peak happens, and then flu season's still going strong because I got my shot too early. Is there a too early? And so folks were still sort of debating about whether there was a too early or not a too early, and whether it was better to have gotten it too early rather than to have not gotten it at all. Like, does it wear off enough that it's problematic? Do I got to get a second dose like in the middle of the season if it happens to run late? So there was a lot of back and forth conversation about that. And I think the messaging got a little bit confused because people were like, well, people said don't come to get the shot. I think what they really were trying to say was you don't need to get your shot August 1st. Like, that by and large, for the vast majority of people, that's probably too early. And that waiting until closer to the fall is probably a better idea. In some seasons where the flu vaccine is limited, usually because there's a manufacturing problem or an issue that happens somehow, in those seasons, sometimes they will tell you, like, let the sicker people go first and everybody else kind of hang back. But that wasn't this year. They really just needed you to like get it in the window that makes the most sense. If you had to pick the most optimal time, normally it's the beginning of September through the end of October. But what I would tell you is that if you showed up in my office on Valentine's Day and you still hadn't gotten a flu shot and there's still flu activity going on, you're going to get a flu shot before you leave the day, unless you tell me a good reason why. Because like, honestly, I wouldn't tell you to not get it. Like, as long as there's still flu circulating, you have a benefit for having the vaccine. And if you really thought that for some reason you weren't going to make it back to the office again, and I had it in August, I would give it to you in August, because I'd rather you have a shot than to have no shot at all. But if I had the option to pick, I would have tightened that window up a little bit and moved it slightly into the fall a bit more.
Thank you. Thank you for explaining that to us. Additionally, can you talk a little more about our sisters who may be pregnant or trying to get pregnant? How do they make that decision of to get the shot and when to get the shot?
That's a great question. So there is no contraindication for getting the flu vaccine when you're pregnant. And in fact, I would argue it's the opposite. So one of the groups of people who tragically gets really sick when they get influenza are women or people who are pregnant. So what we find is that people who are pregnant tend to have big bellies, right? There's a baby there. So you can't take as deep a breath as you normally do. So even if you're doing pretty good, that baby's pushing up against your rib cage. You don't take the breaths that you normally do. That sets you up for pneumonia on the other side of that viral infection. That pneumonia is what gets you and lands you in the hospital and really can cause you trouble. And anything that reduces your amount of oxygenation is reducing the oxygen going to your baby, and that's a problem. And so we just don't need you to have that happen. And so women or people who are pregnant do have a big challenge when they get sick with influenza or COVID. And so the answer is not to not get vaccinated, but to go ahead and get your vaccine. If people are very concerned, sometimes they might wait until after they get to a certain part of their pregnancy to choose to get vaccinated. They don't really have great advice about that. So there's really no good study that says, oh, well, if you wait till the third trimester, it's better than doing it in the second trimester. Really what they want is for you to just not get influenza. And so they would just tell you to get the vaccine in the season that you're in, rather than trying to guess that part out sort of one way or the other, which is a little bit different than some other vaccines where they tell you that you actually can't get those vaccines because they might actually harm the baby that's being developed. That's not the case for influenza. So you actually should get a flu vaccine if you're pregnant.
Thank you. And can you talk some more? I know Dr. Elgin talked about that window of time of going to the doctor if you're symptomatic, because there is a window of time to get a prescription. And I know often when we have a sniffle or a cough, we often say, I need an antibiotic. And that's not really true. Can you talk about what it is we really need when we're, trying to self-diagnose and Google our own symptoms?
Yeah, this is one of those fights that people have all winter long. So one of the things is the semantics thing. And so, I will put it out there. Sometimes when people come in, what I think they actually mean is I need treatment, but what they say is I need an antibiotic. An antibiotic is a really, really specific treatment. So antibiotics are medications that specifically work against bacteria. Well, influenza actually is not a bacteria at all. It's a virus. So is COVID for that matter. And so giving you an antibiotic doesn't really kill the virus. So it's not going to actually treat you for the thing. So you get a lot of people pushing back and saying, absolutely not. I'm not giving you an antibiotic for your cold, for your virus. That's just not going to happen. So then people get into a tussle about it. What I will tell you is that I don't know that most people realize that an antiviral medicine is different than an antibiotic. I think they think they're all the same thing. And so, this is one of those times where I think, the doctor could slow down a little bit and make sure that you understand what you're asking for. And then the patient could slow down and listen for a second, because the reason I think most people think that they need an antibiotic is because they are deadly concerned that they are going to get a sinus infection and it's going to go to their brain and they're going to die. And what I would suggest to you is that that's because you watch a lot of TV and they always show you the case of the person that has, like the one person that had that problem, which makes everybody really afraid. And what I would suggest to you is that there are some groups of people who, when they get sick in the winter, probably do need an antibiotic, but why they're getting it is for a really different reason than what you think. So for example, people who have asthma or people who have COPD, who are having an acute exacerbation. So when their asthma or their COPD is actually all flared up, they often do get put on an antibiotic, even though the trigger that may have set them off was a virus, but they're not getting put on the antibiotic to treat the virus that triggered it. They're getting put on the antibiotic because the mucus that's getting trapped inside of their lungs because they can't breathe because of their other lung disease is setting them up to get pneumonia, kind of like we talked about with the pregnant woman that couldn't take a really good deep breath. And so that person is getting put on antibiotics to help prevent them from getting sick as a result of their exacerbation of their other disease, not of the actual virus or the cold that they got in the first place. Similarly, there are some people who get sinus infections that need to be treated with antibiotics. The part that people never hear about, which gets them into trouble, is that the magic number is 3 weeks. So you had to have had your sinus infection, so that pain, that pressure, that discharge from your nose for 3 weeks straight before we should be talking about putting you on an antibiotic. And so most of the time people are like, it's been 3 days. And I'm like, I hear you. And what you really need is decongestants and a nasal spray and maybe a saline rinse, and I can actually make you feel better. But you don't need an antibiotic because you wouldn't have had enough time for the bacteria that we're actually worried about to have grown. And giving you the antibiotic sets you up that maybe the time you do come in contact with the bacteria, you now have a resistant one because you've been on the antibiotic and now it doesn't work the way it's supposed to, which is actually quite problematic. And so what I suggest to people is that you're not calling telling people what to give you. You just call and tell them you don't feel good and you think you might need to get treated. And I caution people, because one of the things that's happened recently is people call and they're like, I need you to give me, and they'll name the medicine for COVID because they've seen the commercials and they've heard about it. And I'm like, but I don't even know that you know that we have COVID. How do you know that COVID is what you have? And they're like, yeah, but I saw the commercial on the TV and I need to have that drug. And I'm like, I hear you. And if it turns out that you have COVID, we'll totally send that script in. But can we talk about it? Because if it turns out you have flu and I send that script in, not only did I just waste your money, I also wasted your time window. And now you can't get the medicine you really needed in the right window of time. And so I didn't actually do for you what you needed, which makes me a really bad doctor and you a sick patient. And that's not really a great look. And so often I find that it's just more slow down a little bit. Your big job is to figure out, I don't feel good. And then you just got to let me know. We can figure out the symptoms and figure out what we need to do. And in many cases this season, I really think people probably ought to be getting tested because it's very hard to tell the difference between some of these upper respiratory things. And I really do think you want to get tested so that you can get treated for the right thing. And so honestly, most of the people I probably wouldn't even bring into the office first. I would send them to get tested so we could figure out what we needed to prescribe and get them going in the right direction.
Thank you so much for that. And again, we do become our own physicians and try to self-diagnose ourselves. But to Dr. Elgin's point, getting into the doctor's office as soon as possible and asking questions. And I think that's really helpful. Dr. Savoy, you talked about how we can't be afraid to be our own advocate, have agency to speak up and to have those conversations. And again, going in, and I believe what you said was, I need treatment, not go in asking for a particular type of treatment. And again, a key point that I came away with is we're still wearing a mask, we're still washing our hands, and if we're sick, stay home and take care of yourself and seek medical care. And again, I think we have to continue to say that message to individuals because we are getting mask weary and want to, Dr. Elgin, with the holiday season, take off our masks, but it is still important, especially in public places and around vulnerable family members, that we are masked. Well, thank you so much. This has been so informative. When we started the conversation, we had 70% of our audience who had received the flu shot, 30% had not received it. We did not ask why, but I'm hoping that after this conversation that 30% will seek to get the flu shot. And if there was any hesitancy, that they have now had their questions answered. So thank you so much. NCNW seeks to get the facts out so that we can beat influenza. And for our audience, we thank you for joining us for this very informative, and I told you it was going to be really informative, and it was a lot of information. And so I believe that this will be available on our YouTube. And if you could also get additional information from our website. So continue to follow us for more important programming. Again, Dr. Savoy, thank you so much for your time. We truly appreciate you. And Dr. Elgin, as always, thank you for your leadership. with the Health Equity Committee. And again, to Dr. Daly, who led us off with saying she got shots in one arm for the flu and one for the COVID and booster. And we follow her leadership that we all want to be healthy and safe and to enjoy the holiday season. And so with that, I say good night.
Okay. Oh, I just before we said goodnight, I just wanted to really quickly add, we had a couple of audience questions if we wanted to answer. Is that okay?
That is.
Okay,
And
wonderful.
it's that Whitney voice. Thank you.
Thank you. All right, the first question, this is a question I had, Dr. Savoy. What would you say to people who have a perceived lack of accessibility to the flu vaccine? Many people say that the flu vaccine is, or don't get the flu vaccine because they feel it is too expensive, or they feel that there are barriers to get to access to the flu vaccine.
So that's an interesting question. So a couple things that I think come up for folks is that they think you have to have a whole appointment with a doctor to get a vaccine, and that's not entirely true. So most primary care folks will allow you to do a flu shot as a nurse visit, which doesn't come with the same copay and some of the other costs that come with getting vaccinated. There are a lot of places where you can get flu vaccines. So it's not even just in your doctor's office. You can certainly get them done at a pharmacy. You can get them done at clinics. Most public health clinics have flu vaccine available for free that they've gotten from either the state or the CDC. So that doesn't come with a copay at all. Now, sometimes those require a little bit of a wait, meaning that like they have a set time when they have them, or there's a line. So it may not be as easy as like just walking into the store and getting it, or walking into a walk-in clinic at your doctor's office to get it, but it's still the vaccine. So you still get what you need. I've not actually seen a challenge with people being able to get access to vaccine if they wanted to have it. And so I think that in the past, there have been times where there were shortages or it was just more difficult. I'm not really seeing that right now. And so for most people, I don't know that that's a problem. If you're very worried about what the cost of it's going to be, you can talk to your doctor's office ahead of time, or you can talk to your pharmacist ahead of time. They can give you some advice. There are certain vaccines, particularly like if you're on Medicare, where you have to get vaccines in one place versus another because they're covered by your pharmacy benefit versus your medical benefit. But influenza is not one of them. And so that's not one where you have to worry about that. So you can get that vaccine in any of those locations without a problem.
And can I also add, I work in the intensive care unit, and when we have someone that's admitted, and this is not to say any of our participants will be admitted, but just so that you'll know how much access there is for the flu vaccine. If it is reported to us that you have not received the flu vaccine, you will get it before you're discharged. And depending upon your age, you'll also get the pneumonia vaccine as well. So that's just something to put in the file drawer if you have family members that did not have the vaccine and you're concerned and they are admitted to the hospital. That is a part of their one of their discharge plans that they have to do is administer that vaccine before they discharge you home.
Okay, so it sounds like the flu vaccine is extremely accessible. All right, so the next question is about the pneumonia injection. Do you recommend getting that along with the flu vaccine?
Yes. The difference between the pneumonia vaccine, and so yes, you can get them on the same day. The difference between the two is that the recommendation is a little bit different. So not everybody has to get a pneumonia vaccine, but there's a big number of people who should. And so young people, so if you are in that age between 19 and 64, you might need a pneumonia vaccine if you're a smoker, or if you have other lung diseases, so things like asthma or COPD. You might need it if you have kidney disease or kidney trouble. Diabetes. So if you've got like chronic medical conditions, it'd be worth having a conversation with your doctor to ask if you're eligible and in that sort of 19 to 64 age group. When folks get to be 65, it's an expectation that we need to give you a pneumonia vaccine because there's actually particular ones that are helpful. There's 2 different pneumonia vaccines. So depending on which one they have available for you at the time, sort of depends on if you need one shot or whether you need 2 different shots. And so there's a little bit of complexity that happens there. But it's not hard, and it won't be difficult for you to figure out. But the answer would be yes. Like you really should have that conversation. Older folks, by and large, the answer is you're going to need a pneumonia vaccine if you haven't had one yet. younger folks, there's just a lot of people. Oh, I forgot the biggest group, smokers, people who smoke, who are between 19 and 64 are supposed to be getting a pneumonia vaccine. But you don't need one every year though. So pneumonia is not every single year. It's a little bit different, but it's still important to talk about, and it's important to double check to see if you're in that group that ought to get one.
Okay, thank you so much for that. We have two more questions. The first of which is, how do we reach people who primarily get their news and information from social media? How do we connect with them about truthful information?
We have forums like this, and we have little snippets like this on TikTok that are informational. We have different means of email and different social media platforms that we just give bursts of information. But the most important thing is being on the ground and getting the message out that these vaccines are important, and it's essential to the welfare of just not one person, but all of us.
So one of the things that I share with patients and just friends and family in general, I like social media. Like, I'm a person who's got, I've got my Twitter account. I don't spend a lot of time on Instagram because I don't think I'm cute enough to be in all those photos, but like, I do like following people and sort of seeing what's going on. I won't lie to y'all, TikTok has lost me. I don't, but like, I see a lot of folks' videos and things. So I get the attraction and I get the appeal. I understand why people like to do it. Where people go wrong is that they think that everyone in the world is as honest and thoughtful and kind as they are. And so you show up into space, how you are, and you probably wouldn't be a person who would intentionally put out wrong information, or who would try to make a graphic that looks like one way when really it's supposed to be different, or wouldn't try to tell people something because you were trying to hurt them. You probably wouldn't do that. And so what people do is they prey on that. So they know that you wouldn't necessarily do it. So instead, they sort of feed you information in ways that make it seem as though it's totally legitimate, and that the thing that you're talking about or the thing that you're sharing is actually true. And if they think that if I say it enough times, or I show it to you enough times, that it will make you think that it's true or it's trustworthy. And they lean into the idea that we trust our friends and family and the people that we know. And so our influencers and spaces in real life are same as our influences are often in social media. And so if I get a post from my sister, I'm more likely to believe that post because it came from my sister. The problem is that most of the time nowadays, you're not sending the post that your sister actually made. You're sending a post that your sister saw somebody else send, that somebody else sent, that somebody else sent, and the very first person might have been evil and you didn't know, or they just didn't know that what they were sending wasn't true. And so often what we talk about is not being on social media, or that social media is evil or bad or somehow not great. There's a ton of really awesome, great information and really cool people that can teach you a lot. What you have to do is trust but verify. So I need you to go look for some other way to find that out. Don't just read the headline, click and see the actual article and make sure what they're saying makes sense. If what they're telling you sounds too good to be true, it's probably too good to be true. If what they're telling you sounds far-fetched, it probably actually is far-fetched. And being able to double check and verify, and knowing sort of what the resources are that you're using to like back up what they're doing. They actually have fact checkers now that you can use that will let you see whether or not the website or whether the article that you're reading is actually true or not true. And I found those to be quite helpful. And so it's not that you can't be on social media. And if you got the opportunity to drown out some of these bad voices by sharing true and accurate information, then you definitely want to do that. But please just remember that like not everybody out in social media space is who they say they are, because some of these people aren't even literally who they are appearing to be. But there are people out here with really bad intentions who are honestly doing stuff just to get you riled up and doing stuff just to make you, I don't know, make decisions because they have an idea and they want you to follow that ideology and they want to sort of get you in a pathway. And I just hate to see people get caught up in it when honestly they just were getting information from a friend or somebody that they actually did trust. And that other person didn't mean to send them wrong or bad information. They were just retweeting something that they got from somebody they thought they could trust too. And I just tell people they need to verify. So you can trust your friends, but you got to verify that information on social media because sometimes people are just scammers.
Thank you, ladies. That was actually our last question. So thank you everyone in the audience for your extremely well thought out and interesting questions. I'm going to toss it back to Ms. Rosalind Hannibal Booker to close this out.
Thank you. And they were some excellent questions. And I learned another tidbit about the ammonia shot and information that I think will be helpful to me personally. So thank you for this really great information. And just before we close out, I want to share some additional announcements to our audience that you can begin to count down with us for Giving Tuesday, which is a global day of giving on November the 29th. So please consider NCNW for your donation and consider designating that donation to Trees of Hope, our international program to bring trees to countries that are in need. And then also, as you begin that holiday shopping, NCNW is a member of Amazon Smiles. So portions of your eligible purchases will go to support our mission and to continue to do good work like we've had this evening with information from these incredible ladies. And so again, thank you. Dr. Elgin said it earlier, how we beat influenza and other preventable diseases is by getting the truth, getting the facts. And so we hope that you heard information that will help you, that you can share with your family. Again, this information and this broadcast will be on our YouTube channel and I believe also on Facebook. And so if you need to go back and get a refresher, that information is there. Again, thank you, thank you, thank you, Dr. Savoy. We really appreciate you so much. Dr. Elgin, thank you. We look forward to seeing you the next time for another important conversation about health and staying healthy. Everyone, enjoy your evening. And I think this is the final. Good night.